So if you're thinking of starting on Alesse as a birth control pill and wondering what you might be getting yourself into, or if you've already started Alesse and you notice that there's something strange in the neighborhood and you might be wondering if it's related to your birth control, this is the show for you. In this episode, we're going to look at the 10 most common side effects experienced by users of Alesse. Let's get started. Okay, so in the left column we have the Alesse, and in the right column we have placebos, or what I'm calling a sugar pill. The reason we need that is to compare, is the effect real, or is this just figment of someone's imagination, or is it completely unrelated to the drug? All right, so the first most common side effect noticed by users of Alesse was headache. Now, notice that the incidence was 31.5% in users of the real drug versus in placebo, 30.1%. So in other words, if you subtract the effect of the placebo, it's really just an incidence of about 1%, and that would agree with what I've seen clinically. I do not generally have anyone who suffers with severe headaches from taking Alesse. The next most common one, number 2, was irregularities of the period. So either the periods lasting longer than they should, spotting through the cycle, things like that. So that was noticed in 21.8% of users versus 3.9% of people taking the placebo. So I would say that is a real effect, and that also gels with what I've seen in clinical practice. Period irregularities are one of the most common reasons where I have to switch someone's birth control. Okay, next, which would be useful to know, is nausea, number 3. Nausea was noticed in 14% of users versus 11.3% of those on a sugar pill. So again, if you subtract the two, it's not really a great effect. And again, I haven't really had a lot of problems with people experiencing nausea in clinical practice from the Alesse. Maybe just at the beginning, or if they took it on an empty stomach or something like that, but it's usually very self-limiting and passes. Number 4 was sore throats. Now, I have no idea what was driving this because I have not seen this in practice, but in real users, it was quoted as 13.2% as opposed to 16.3% of people taking a placebo. So go figure. In other words, people taking the sugar pill had more sore throats than those taking the Alesse, which suggests to me that it probably never had anything to do with the Alesse. Number 5 was abdominal pains. That was noticed in 7.7% of users as opposed to 6.8% on placebo. So again, the true incidence is probably closer to 1%. And sometimes it's hard to figure that out when you're quoting statistics for birth control, because things to do with the period and period cycles usually are painful anyway. So it's hard to say, was this really because of the birth control? Number 6, probably somewhat related to belly aches and belly pain, was period pains. And again, you would expect that those would be fairly similar because it's sometimes hard to distinguish true abdominal pain versus a period pain. So for those candidates who were able to distinguish that it was their period, or maybe because not so much the quality of the pain, but the timing of the pain around when they had the menses, that was noticed in also 7.7% of cases, as opposed to 11% taking a sugar pill, which would suggest that the Alesse actually reduces period pains. All right, number 7, as with all drugs, there were some people that complained of allergic reactions. This effect was relatively small, 4.6% of users, as opposed to 1.7% just taking a sugar pill. I was getting a little cramped here. All right, number 8 was breast pain. And again, that tends to be related to cycles and menses and your hormones. In true users of the Alesse, that was noticed in a small proportion, 4.6%, and that compares to 3.1% just taking the placebo. Number 9 was complaints of nasal congestion or rhinitis, and that was noticed in 4% of users as opposed to 3.7 of those on a sugar pill. Why that would be, I am not sure, and in my personal experience, I really have not seen this as a significant effect. In 20 years, I've never had anyone come in on Alesse and tell me, "Doc, I gotta stop this because my nose keeps running from it." Maybe that has something to do with allergic reactions, because as you can see, the incidence is almost the same, 4.6 and 4%. All right, and finally, number 10, most common side effect of users on Alesse was asthenia, or feeling tired, draggy, low energy. That was noticed in 3.7% of users as opposed to 1.4 taking a placebo. And this can be very devilish to try to determine if it's related to a drug, because one of the most common complaints in modern society is tiredness regardless. Modern life is just stressful. We stay up too late at night, wake up too early in the morning. Now, while not one of the top 10 side effects, a lot of people are generally interested in weight gain. So I just put that in there. It's not one of the top 10 side effects, but the incidence on Alesse is 3.4% of users as opposed to 2.3 taking a placebo. So overall, as you can see, it's quite well tolerated. It's definitely worth your consideration if you're in the market for a birth control. Most of my patients that have started on it have liked it. Some of them have been on it for many years. But the most common reason I usually will have to terminate treatment with Alesse and maybe try a different birth control or a different option is usually because of this one, number 2, period irregularities. Either it's not controlling the period well enough, not controlling the cramps well enough, or the periods are still irregular. So then I'll have to try something that's a little stronger. Also notice that Alesse is not only indicated just as a birth control agent, it also helps with acne. So it's generally a favorite among younger females looking for birth control and also suffering with acne. In addition, because it's pretty much weight neutral, a lot of people like it, and the reason it's weight neutral is because it's on the lower end of the spectrum for hormones. So I hope this helps you. Thank you for watching, and you're welcome.